Dr. Overlord.
Hi, Dr. Overlord. This is Rufus from the blood bank.
Yes, Rufus. How may I assist thee?
Well, I don't know if it's my place to say anything.
Rufus, I grant you permission to speak freely.
Oh, well, I just read your new policy and I just wanted to understand it a little better. It sounds like we're supposed to stop calling the resident for everything like we used to do, and we're supposed to bypass the resident now and go straight to the attending. This is for everything, including calls, reports, everything. I'm sorry, but am I understanding this correctly?
Correct. You understand superbly.
Oh, okay. Well, I hate to be difficult, but is it okay if I ask what caused the change?
Oh, it's very simple. The resident can't write the report because we can't bill for it unless the attending signs it anyway. But worry not, the resident will still be exposed to lots of issues and learning topics.
Oh, well, couldn't the resident write the reports, but then you edit and sign them? I mean, that was working pretty well in the past. And besides, what do you mean by they will be exposed to things? I must say that sounds suspiciously like a go-read rotation.
Yes, exactly. It will be a go-read rotation. But I will meet with them every now and then and tell them stories about what I did. Plus, they will observe some things on occasion.
Oh, okay. Stories and observe. Well, observing is very different from doing. I once heard a saying that nothing focuses your mind like putting your name on the line, but the word wasn't your name, you know what I mean?
Why, if the resident is ready and interested, then I suppose the resident can do certain things.
I see, but can do things and must do things are very different. Isn't that a very low standard? And how could a resident be ready if they never really start?
And plus, the residents are still involved.
Oh, good. How so?
They will transport patients from place to place.
Transport patients? Well, doing something is different from doing something that's a pathologist level task, right? Isn't that important to, becoming a pathologist?
Yes, but they are still involved in such tasks. They have a checklist, and they are required to do 5 transfusion reaction workups per rotation.
5 whole reactions? Oh, okay, I see. But isn't that just a token chore? I mean, sure, that's something, but the magnitude of responsibility is still pretty close to nothing. What about calling them while they are, on call?
No, listen, I have to come in anyway, so why bother the resident?
Oh, yes. I mean, you have to come in anyway, sure, but my argument wasn't that you shouldn't come in at all. It's that, why not give the resident first crack at it? Work together, train them the first time, gradually give them more responsibility over time. You're just kind of making the same argument now that you did a minute ago when you said that you can't bill and you have to sign the report anyway. Have the resident do everything up to that limitation.
That's all well and good, but residents are not even interested in my little subspecialty. They all want to go into other things.
Well, first, does it matter if they're interested or not? I mean, it's part of the graduation requirements, right? And second, how can they even judge if they're interested or not if you don't give them a realistic idea of your subspecialty?
Also, the techs don't want to call them because the resident doesn't know what to do.
Yet. The resident doesn't know what to do yet. I mean, not knowing is actually the best reason to call them, so that they learn by doing.
What do you mean when you say learn by doing?
It means I can remember things that I've done much better than I could remember things that I've only read about.
Listen, Rufus, Dr. Overlord is busy with very many things and he really must get back to work.
Could it be that you just don't want to train them?
I beg your pardon, Rufus?
Even if you don't like it, isn't it still part of the job description if you work in an academic hospital? I mean, what did you say once about that 8 a.m. resident conference?
I said, I love having resident conference at 8 a.m. because I get so much work done when there's no resident around.
See, that's what I mean. Stop rationalizing. What's the real reason?
Fine. If you must know, the real reason is that I don't want to spend the time or the effort training residents. I went into academics so I can get paid to read Dilbert, act like I'm important, and put my name on the occasional case report that someone else writes. If I can avoid the whole resident training part, then even better. I don't care if the residents learn anything, if they gain any employable skills, if they get called, if they gain experience doing my job, if they cover for each other when they are absent, or even if they find a job after their 5 fellowships. Is that clear enough for you?
I must say, that is clear. But wait a minute. Speaking of jobs after fellowships, don't you often complain about how hard it is to find people to join the faculty right out of training?
And your point is?
Well, isn't the only way to make a good graduate is to make a good trainee? Isn't that by itself a good enough reason to train pathology residents, just like residents in every other specialty?
Yes, but I'd rather spend my time complaining than doing something about it.
I have a gold chain. That means I'm better than you.